My name is Patricia Byrd, and I'm from Panama City, Florida. I served as a social worker at the Florida Department of Elder Affairs for 27 years before retiring. I am incredibly proud of the work I did. I always knew I wanted to be a social worker because I wanted to be able to go to bed every night knowing that I helped people. I visited thousands of homes trying to make sure people had access to services that they would need. I've spent countless hours making sure people had access to Medicaid. I have seen how their lives improved once they had access to the services provided by the program. I have seen how Medicaid allows people to stay at home longer, and it gives caregivers, husbands and wives, daughters and sons, the support they need to take care of their loved one with dignity. Nothing can prepare you for how hard it is to take care of a loved one in need. Not even 27 years of working with families facing hardship. You see, Medicaid is also important to my family. I have a 92-year-old mother in a nursing home. She is wheelchair-bound, she's incontinent, and she has dementia. Without Medicaid, I don't know how we would afford to pay for the care she needs. We used all of her financial resources, even cashing in her life insurance, to afford her care. Her Social Security check, minus a few dollars, goes to the nursing home. All of this is still not enough to cover her care, so we were forced to apply for Medicaid. My husband and I are on Medicare and Social Security. We worked hard all of our lives, but we're not rich. We worked hard to provide for our children so they could be better off than we are. But now my husband has Parkinson's and we're getting older, and I'm worried that Medicaid won't be there for us if we need it. And we're just like millions of other Americans in the same position. Now, let's not forget, Medicaid doesn't just help older Americans. As a mother and a social worker, I have also seen how Medicaid lifts up children. Children with great potential who, through no fault of their own, must rely on Medicaid for their health care. Medicaid provides these children with basic care so that they can go to school healthy, not have to worry about whether their family can afford to take them to see the dentist or the doctor or get medicine if they need care. We owe this to every single child and every single family. That's what I worked for my entire life, to help working families, families like mine who just want to contribute and get a chance to get ahead, to fulfill their potential and live a life with dignity. Maybe Paul Ryan and President Trump never had to deal with any of this in their lives. Maybe no one in their families has ever needed Medicaid. But I'm here to tell them that after a lifetime of sacrifices, playing by the rules and fulfilling our responsibilities, my husband and I are now find ourselves facing impossible choices if they move forward with their plans to gut Medicaid. And our story is not unique. There are millions of families in situations just like mine. I have seen them up close. I have lived this my whole life. Any elected official who votes to cut Medicaid should have to come back to their districts, look these families in the eyes, and tell us, what exactly do you suggest we do now? And to Paul Ryan, Donald Trump, and Congress, I want to send this clear message. Medicaid is a life-saving program that lifts up countless families. These are our parents, our children, and our family members. And one day, it even may be you. So please, hands off of our Medicaid.